Thank you all for joining our third Antimicrobial Stewardship Office Hours. Our speaker today is To Pham, very excited. Prior to joining the Arizona Department of Health Services, To completed a 2-year infectious diseases translational research fellowship at the Midwestern University College of Pharmacy Glendale campus. She also completed her PGY1 pharmacy practice residency at Honor Health John C. Lincoln Medical Center in Phoenix, Arizona, and received her Doctor of Pharmacy also at Midwestern University College of Pharmacy Glendale campus. She currently serves as the Antimicrobial Resistance and Antimicrobial Stewardship Lead at the Arizona Department of Health Services, as well as a faculty member at the University of Arizona R. Ken Coit College of Pharmacy. To's interested in antimicrobial stewardship, public health, and education. Just as a couple housekeeping items, we're going to ask that everyone remain on mute during the presentation. Please feel free to type any questions in the chat, and after the presentation is over, you can either raise your hand if you have a question and would like to verbally ask it, or type it in the chat and I will read it. So with no further ado, I will hand things over to To.
Thank you, Kelly, for your wonderful introduction. So without further ado, I'm going to get the office hour session started. So today we're going to talk about human microbes. All right. So as usual, I don't have any relevant conflict of interest to be disclosed. Okay, so we're going to start our sessions with a fun fact that the adult intestine is estimated to contain over 1 kilogram or 2.2 pounds of bacteria. So that is approximately the same weight as the human brain. And there are trillions of microbes live in our GI tract that are highly diverse with different types of bacteria, viruses, as well as the fungi. And the gut microbiome plays a very extremely vital role in maintaining our overall health. In addition to making nutrients, the gut microbiome also supports the body immune system and affect brain functions with the gut-brain axis, and which consists of an intricate network of neurons, proteins, and chemicals that relay the messages between the digestive system and the brain. Okay, and that leads us to our first test your gut instinct questions of the day. So your gut is home to trillions of microorganisms and collectively known as your gut microbiome. When this delicate balance is disrupted, a condition called dysbiosis can occur. Which of the following is most likely to contribute to the gut microbiome dysbiosis? A, eating a diverse diet rich in fruits and vegetables, B, regular physical activity, C, taking a broad spectrum antibiotic course, or D, spending time in nature. All right, it seems like we have the majority of them for taking a broad spectrum antibiotic course. You guys are on top of this topics. And I should have been a bit more clear on the negative disruption, but A can also potentially be a good answer as well. All right. And yep, that C is the correct answer. So given the fact that the gut contains the greatest concentration of bacteria in the entire body, it is not surprising for us that it is frequently a target for antibiotic activity. Alterations of the gut microbiome after antibiotic allow for C. difficile spore germinations and the outgrowth of the vegetative cell, and suggesting that the alteration in the gut bacterial metabolisms are important for the colonization resistant against C. diff. And as we all know, C. diff is a poster child of the gut microbiome, but the field of gut microbiome has really flourished for the past few recent years. And a short course of antibiotic can alter the gut microbes for several weeks or even months, especially with broad spectrum antibiotics such as fluoroquinolones, such as ciprofloxacins here. And of course, exposure to different antibiotics resulted in an increased abundance of genes associated with antibiotic resistance, and the complete recovery time depend on the spectrum activity, as we can see. And another question for test your gut instinct. Antibiotics are powerful tools against bacterial infections, but they can also have unintended consequences for our gut microbiome. Which of the following statements best describe the impact of antibiotic on gut bacteria? A, antibiotics selectively target only harmful bacteria, leaving the beneficial bacteria untouched. Or B, antibiotic can reduce the overall diversity of the gut bacteria and including beneficial species. Or C, the gut microbiome fully recovered within days after a single course of antibiotics with no lasting effects. Or D, antibiotics encourage the growth of a wider variety of gut bacteria. All right, I'm seeing bees trickling in, and yes, that is the correct answer. And as you can see, the impact of the altered gut microbiome can be pretty detrimental because of that gut-brain axis. So what happened is the foreign microbes gonna outgrow the commensal bacteria that are already there and lead to the permanent changes in the gut microbiome structure and can actually increase the reservoir of the antibiotic resistant genes within the microbiome. And the alterations of the gut microbiome can actually lead to the pro-inflammatory state and can range from GI metabolic disorder to immunological and neuropsychiatric disease. We're going to go in depth for the rest of the conversation here. Okay, first and foremost, we're going to talk about the metabolic disorder. The prevalence of the obesity has increased worldwide among children and adolescents between the 1900 to now 2022, with close to 65 million girls and close to like 90 million boys between 5 to 19 living with obesity. And the cost to take care of obesity-related complications are high and estimated to be up to 1.3 billion US dollar. In this slide, you can see this is the projected US prevalence of obesity and severe obesity of the adults. You can see on your left side, this is where we have the start with the very yellow, which is low prevalence, versus the red and dark blue. So this is going to be up to 60%. So that is definitely a concerning trend for us. So why is it important for us to talk about adolescent obesity? It's mostly because antibiotic consumption in children, believe it or not, antibiotics are by far the most prescribed drugs in children, with a national average up to 600 prescriptions per 1,000 person. And this was the data reported in 2022. And more than 50% prescribed antibiotics, similar as we can see in adults, are either unnecessary or inappropriate. And the most common indications is the viral upper respiratory tract infections. And children with the same infections can receive vastly different rates of antibiotic prescription depending upon who their clinicians are. And this slide is a further breakdown into what specifically the age group between 0 to 2, adolescents, and to geriatric. You can see that between 0 to 2 and 3 to 9, so the first 10 years of life, for total, pediatric patient receive more than 2,000 prescription per 1,000 per person. That's like on average, one person for 2 antibiotic prescription for every one person. And that is extreme. And also, don't forget that that children or pediatric can also have their perinatal antibiotic exposure from the mom. And they also have the extensive variation in use, and of course, the unknown exposure magnitude from forming antibiotic use really on that One Health concept. And this is a scary phase. And as we all know that now, the common antibiotic in children are mostly penicillin, cephalosporin, and macrolides. So these are commonly seen for outpatient prescriptions. And the downstream outcome of antibiotic overuse can be very detrimental, not in addition to the adverse medication effect as nausea, vomiting, diarrhea, or rash, and of course, C. difficile infections. But I think the most important we're gonna cover today is gonna be the diversity and composition of the gut microbiota, and AKA dysbiosis. So what exactly is gut dysbiosis? So as we know from earlier slide, that gut microbiome plays a crucial role in human health, as we have help digest host nutrition, maintain homeostasis, resistant to colonizations, and as well as the development of the immune system. And this is a flow chart to show how the how the damage of the gut dysbiosis to the microbiome slow to reverse. So we have altered gut microbiome. They're going to alter the circulating level of the digestive enzyme and amino acids that is produced within the GI tract, and it's going to affect the nutrient absorption and shifted or affected the gut-brain axis and lead to that metabolic imbalance. And they're going to lead to either obesity or that chronic inflammation state. And these three over here, they like it's a vicious cycle. So much that for this is a really great study from the Mayo Clinic that they're looking at, okay, so what is the impact of antibiotic exposure in the first 2 years of life and the risk for childhood illnesses? In here, you can see on this over here, we have a very commonly seen condition such as asthma, food allergies, celiac disease, ADHD, autism, but I want to focus on overweight and obesity, and you can see is significant. And of course, as anticipated, the more antibiotic the children been exposed to, the higher the risk, the higher probability they're gonna have developing these common chronic comorbidities. Right, and we're gonna shift our gear to neuropsychiatric and neurodevelopmental disorder. And that lead me to the next test, your gut instinct, number 3. The gut-brain axis is a fascinating area of study, highlighting the communication pathway between your gut and your brain. If your gut microbiome is severely imbalanced, which of the following symptoms may you potentially experience due to disconnection? A, improve cognitive functions and memory, or B, reduce feelings of stress and anxiety, or C, increase risk of mood disorder like depression, D, enhance overall well-being, or E, I'm not sure. Mm, all right. I'm seeing C twiggling in. Yep, that is the correct answer. Okay, moving on to the next one. This is just really give us like what is the mechanism and what are some of the pathway on the impact of antibiotic use that lead to potential neuropsychiatric disorder. Is the gut microbiome, as you know, produce neurotransmitter hormones and metabolite that can affect our emotion, thought processes, and behavior. So therefore, when the antibiotic disrupt the compositions and diversity of the gut microbiome, like, for example, the effect of a short course, a 7-day of clindamycin has been shown to remain effective or remain that impact for up to 2 years with some of the key taxa or populations failing to return to their original compensations. And of course, this biosis is going to lead to the neurotransmitter production and inflammation, and that has been associated with a wide variety of mental health disorders such as anxiety, depression, schizophrenia, and even autism. And the exposure to antibiotic may increase that depression and anxiety risk. We're going to go over the next few slides. And here is I'm going to talk about the first report of an antibiotic-induced depression. It's a very fascinating case from the Colorado group that was in 2010, so pretty recent. So they reported a 75-year-old man without any history of psychiatric illnesses became acutely depressed and subsequently committed suicide. And during that, when they're looking back, the investigation looking at what happened, the only thing they can find is notable in the chart is that patient received levofloxacin and Bactrim for the post-operative wound infections. And the antibiotic therapy was actually considered the principal cause of his suicide at the coroner court. So fascinating, right? So what are some of the risks of exposure to antibiotic? There have been so many great data out there, but I'm going to highlight on the few key data that we have seen consistently, or the first few. So for Lurie et al., this is a nested case controlled study between the 1995 to 2013. They have close to 300,000 patients with depression and about 15,000 with anxiety and close to 3,000 with psychosis. And within that, they're able to have a little bit over 800 match control to looking at what is the effect of antibiotic exposure. And they have found that the treatment with just one single antibiotic course is associated with a higher risk of developing depression and anxiety diagnosis. And the recurrent antibiotic exposure amplified the risk for depression and anxiety. And that leading up to the next study conducted at the Johns Hopkins primary care group, that they're looking at the pediatric and family practices between 2013 to 2019, and they have a little bit like less, but it's about 5,000 patients. And they also found consistent similar result with Delury et al. That they have found that receipt of an antibiotic and broad-spectrum antibiotic has been associated with an increased risk for developing anxiety and depression. And another study in Finland, they're looking at a nationwide registered base cohort between 1995 to 2013. So that is almost like close to 20 years. And they have a little bit over 1 million individual with a close to 9 million person year follow-up. And they have found, again, consistent with what have been shown in the literature, that the risk of mental health disorder increase in a dose response association, meaning a patient have a higher, more acute and more severe infections that require hospitalizations, the number of treated infection, which indirectly increase the risk of exposure to antibiotics, as well the number of different antibiotics and spectrum activity is going to increase that risk of developing mental health disorder. And how about our pediatric populations? So in here, in this population-based registered cohort between 1996 to 2012, we have a little bit over 200,000 children with exposure to antibiotic during early life and follow into with the earliest major acute depressive major disorder for mental health diagnosis or the first 19th birthday. And on the right side, this is a forest plot looking, and this is the chart looking at what is the hazard ratio in between the exposure and different type of antibiotic. And what they found that patients who got exposed to 3 or more different antibiotic courses is going to have the increased risk of developing um, these psychiatric disorder and and also that the postnatal exposure or actually the perinatal, especially during the later term of the second trimester, third trimester, as well as the post-pregnancy, especially with tetracycline, aminoglycosides, quinolones, and Bactrim has been associated with a significant risk of increase to have that like those major mental health disorder. Another similar study that is conducted in South Korea, they're looking at the nationwide population-based cohort study and sibling analysis between the 2008 to 2021. And they're looking at to those with or without antibiotic exposure during the pregnancy or early infancy, the first 6 months of life. And they have quite a lot of patients with close to 2 million children in each arm. And what they found similarly over here is that what is, and so during that, in the pregnancy cohort, all the prevalence of antibiotic use, exposure to antibiotic during the pregnancy is associated with the increased risk for all 4 neurodevelopmental disorder. And especially during the early infancy, the intellectual disorder has the highest correlation or have the highest risk when it's come to antibiotic exposure during early infancy. And as well as epilepsy. And when you're looking at the sibling cohort, the hazard ratio is a little bit less, but however, the one consistency to be seen between the pregnancy or early infancy between the sibling cohort is going to be for epilepsy. That's still pretty high up on the list. And that leads me to the next one, it's going to be neurodegenerative disorder. So why are we talking about neurodegenerative disorder? Because Alzheimer's disease and Parkinson's disease have become increasingly prevalent. And despite the Alzheimer's disease have been around for quite a long time now, the pathophysiology as well as the treatment and etiology remain further investigation, but the two most common pathological factors that have been identified is with the amyloid plaques caused by the amyloid beta accumulations or the neurofibrillary tangle caused by the tau protein also during that accumulation during Alzheimer are the most commonly seen pathophysiology issue with Alzheimer's disease. As I mentioned earlier, the etiology of Alzheimer's disease is multifactorial because it can be age, genetics, autoimmune disease, pathogen, neurotoxin, and especially gut microbiome dysbiosis. And that leads us to our next test or gut instinct questions. The Alzheimer's disease is characterized by the accumulations of the amyloid beta plaques and tau tangle in the brain. Emerging research suggests that the gut microbiome might play a role in this pathology, which if the following is a plausible mechanism by which gut dysbiosis could contribute to Alzheimer's development. A, by directly producing amyloid beta proteins, or B, by altering production of neurotransmitter that are essential for brain functions, or C, by promoting systemic inflammation and influencing the permeability of the blood-brain barrier, and D, by enhancing the brain ability to clear the toxic protein aggregate. All right, so I see there is a mix of different answers. So let's walk through the data, shall we? Okay. Oh, and then oops, sorry, I have one more question. The following questions is the gut-brain axis is a bidirectional communication highway. If someone is experiencing chronic stress and anxiety, how might this negatively impact their gut microbiome and subsequently their overall health? A, by promoting the growth of a wider variety of beneficial gut bacteria, or B, by improving nutrient absorptions and digestive efficiency, or C, by altering the gut motility and increasing gut permeability, or D, by strengthening the gut barrier and reducing inflammation. All right, so for this question, it seems like everyone is having their eyes on C. Okay, so let's move on to our next slide. So let's talk about the gut microbiome dysbiosis. So first of all, when you think about Alzheimer's disease, the central role of inflammations in the development and course of Alzheimer is really the main hypothesis between this impact between the gut microbiome and Alzheimer. When you think about it, right, for Alzheimer's disease, they have this chronic release of cytokines can lead to that neuronal damage and death, and also the microglia, which is the brain immune cell, are activated and could create a problem, but they also tend to stay on longer. So therefore, the inflammations actually increase the intestinal wall and blood-brain barrier permeability for that exposure of neurotoxins. And also the gut microbiome definitely going to influences the gut-brain axis and causes dysfunctions because as we all know from previous slide, gut microbiome regulate the digestive pH and create a protective barrier against the infectious agents. And H. pylori, Borrelia burgdorferi, and chlamydia pneumoniae have been associated with the elevated amyloid beta, which is the precursor for that amyloid plaque accumulation, which has been one of the most common most common pathological mechanism for Alzheimer's disease. And we actually have more recent data that suggests maybe the herpes simplex viruses viral infection can also have potential link with Alzheimer's disease as well as Parkinson's disease, but that's like a field that continue to have more data and more research on it. And by that, we're gonna move on to cancer. So the prevalence of the colorectal cancer in the US has rapidly declined, but however, we've seen a very alarming trend of significantly increasing among young adults between 20 and 49 years old, and is actually almost double. And when you look into detail on what kind of colorectal cancer, we can see that So colon cancer is have that split right between here, and that's a lot more. I'm sorry, the rectum has a lot higher annual percent change than the rectum for the younger population right here. And you can see like between the people who was born in between 1940 and 1950, that's really marked the new era of different antibiotic exposure that we can see there that split in between the younger cohort and the older cohort, and as well as the colon versus the rectum cancer location. The gut microbiome have this like irreplaceable symbiotic relationship between the gut and the host because as we all know, gut microbiome is required to produce vitamins and essential fatty acid. And when we have the pathological changes in microbiome are associated with inflammations and potentially the carcinogenesis factor can lead to like resistance to cell death, immune dysregulations, induced angiogenesis, and as well as the mucosal barrier disruption. And all of that going to have the risk factor for disposing patient to have early onset colorectal cancer. So much that one of the landmark trial by Cao Y et al. In 2017, they're looking at the antibiotic usage at the age from 20 to 39, and they classify based on the amount or the long term of antibiotic use with none versus 1 to 14 days, 15 days to 2 months, or more than 2 months. They identified that within the 1 to 14 days, we have 653 cases of adenoma cases being observed. And using the without antibiotic group being the reference group, we can see that even with the A-adjusted, as well as the multivariate, which is controlled for other possible confounding factor for colorectal cancer, the antibiotic use is significantly associated with increased risk of developing colorectal cancer. And moving on to our other cohort between 40 to 59, which is also sees similar trends that they also have a very high case of adenoma cases between 1 to 14 days, and that increased risk with the A-adjusted and also multivariate odds ratio for these patients exposed to antibiotic long term. And another one looking at different type of cancer, as we all know, there's so many different cancer there. And this study had looking at a very big cohort up to over 3 million patients, and they're looking at different type of cancer. They're looking at colon cancer, trachea lung cancer, breast cancer, and prostate cancer. And then they also divided based on whether patient have exposed to 0 to 1 prescription antibiotic, 2 to 5, or more than 6 prescription throughout the time when they get the infection treated to the time they have cancer. And they have found that, again, antibiotic prescription is associated with increased risk of developing cancer. And when we look into further into the durations on like if they have this like annual antibiotic use or exposure for 1 year, 2 years, or more than 3 years, you can see that the cancer risk increase with the longevity or the duration of antibiotic use. And we look further into what kind of cancer, especially among those patients who have more than 3 years of long-term antibiotic use, we see that the top four is ovarian syndrome, non-melanoma skin, breast, and prostate are all associated with increased risk with the antibiotic exposure. And that lead me to the next test for gut instinct questions. If long-term or repeated courses of antibiotic are found to increase the risk of certain cancer, what is the most plausible underlying biological mechanisms that the gut microbiome might play in this increased risk? A, antibiotic directly mutate DNA in human cell, leading to cancer transformations, or B, antibiotic cause a direct permanent sterilization of the gut, eliminating all bacteria, or C, antibiotic disrupt the beneficial balance of the gut bacteria, potentially lead to chronic inflammations, alter metabolism, and the overgrowth of pro-carcinogenic bacteria. Or D, antibiotic boosts the body immune response to such an extent that is inadvertently promote the cancer cell growth. All right. All right. Yes, I definitely agree that C is going to be the correct answer because antibiotics do not mutate DNA cell, but again, it's all boiled down to that shift, that change in diversity of that microbiome can lead all these detrimental effects. So to summarize, what is to talk about the iceberg effects of the antibiotic exposure, right? When we think antibiotic, think about cost, think about adverse effects, but we're looking at the antimicrobial resistance, but we have so many more different factor or the effect with the antibiotic is they have that dysbiosis. It can either be transient or long term, and during this long term dysbiosis, it can also it's gonna be like transfer from like from mom to offspring, and it can be generational altered in the gut microbiome. So it can be a very long term consequences with the overuse of antibiotics. So what are some of the key take-home points? And of course, antibiotics detrimentally disrupt the microbiome by killing all commensal bacteria, and that disruption is linked to various chronic diseases, and of course, reducing unnecessary on or inappropriate antibiotic definitely help with stewardship, One Health approach, and vaccine. And over here, I'm sure you hear from us by now, but our third office hours going, we all understand the importance of antimicrobial stewardship, but I also want to highlight the importance of One Health concept where we all connected with the environment, people, plants, and also animals. And of course, we have this global action plan on antimicrobial resistance. We really need to help as stewards or as clinician and as health professional. We really need to in, increase our awareness and improve education to the public and to really educate the public on the judicious use of antibiotics. And of course, the infection prevention method, including vaccine, has been great. And also to promote the antimicrobial stewardship in human and veterinary medicine because of the One Health concept. And that lead me to the last questions of today's office hour. Given the potential long-term impact of the antibiotic consumptions on the gut microbiome and subsequent disease risk, what is the most crucial shift needed in both medical practice and public perception regarding antibiotic use? A, to view antibiotic as harmless and cure-all for every minor ailment, or B, to encourage widespread proactive use of broad-spectrum antibiotic to prevent future infections, or C, to promote judicious use and targeted antibiotic use, emphasizing the stewardship aspect to preserve the efficacy and minimize collateral damages such as the gut dysbiosis, or they just completely ban the use of antibiotics due to their negative effects. And yes, I'm very happy to see that everyone is on board. Oops, sorry. That yes, we all agree we need to really promote the stewardship aspect and to really promote the tradition antibiotic use. And that leads to my last slide. Thank you very much for your attention. And one famous quote from Louis Pasteur, I cannot speak French, so I'm going to translate in English. Ladies and gentlemen, it is the microbes who will have the last word. And thank you. And I'm happy to take any question anyone might have.